Welcome to Capitol Hill. Well, it may be a case of if at first you don't succeed. The federal government has finally signed the final deal with the states and territories on health reform. It's a very different deal to the one that Kevin Rudd first announced, but his successor Julia Gillard says it will still deliver the same outcomes for patients. Julia Gillard may have less agreement tonight when she sits down with News Limited editors and executives. Joining me to discuss the day's events are Greens Senator Penny Wright and Liberal MP Susan Lee. Welcome to you both.
Thank you, Lyndall.
Hello,
good
Lyndall.
afternoon, and good afternoon, Susan.
Susan, if I could start with you. This health reform is not the initial deal promised, but is it the best deal that can be struck both in terms of the Commonwealth's interests and the state's interests as well?
Well, I doubt it's the best deal for patients. This has wound back considerably from what Kevin Rudd proposed. We now are not 50% but 40%, with most of the actual spending and support coming not now but in 2014, 2015, and 4 fabulous new health bureaucracies all located in Canberra. And imagine the amount of taxpayers' dollars that they will be consuming in administering a system which still doesn't give either the state or the Commonwealth absolute control.
But both Victoria and Western Australia say they are happy with this deal as it has been struck. While it is not the 60% dominant funding Kevin Rudd promised, it will come out eventually at 50%, and the states say that allows them still to have some level of control over their own spending.
Well, 50% in 2017, but academic Professor Dwyer has said that it is a financing reform rather than a service delivery reform. I don't trust Julia Gillard's government with delivering anything in a financial sense by their track record. So what we have here is a divvying up of the spend, but it isn't going to cover 50% in 2017 of every single health dollar anyway. Remember that there's going to be a tribunal or a commission that sets what the efficient price is. So we don't know what it will cost to deliver health services in Western Australia in 2017, but we do know that the Commonwealth won't be funding half of it. So the bureaucracy concerns me, and the fact that we haven't seen evidence the government can get anything right, and this is the third go they've had at this.
Penny, does this show the difficulties that a Commonwealth government has in dealing with the states, that it's very hard to impose what you want on the states, that you do have to sit down and negotiate and there has to be give and take?
I think that's an accurate assessment of what's happened, Lyndall. In fact, I think that Julia Gillard is a good negotiator, and people recognise that. Of course, she can't impose an agreement where it's going to be a state and federal agreement that's reached, and so there has been negotiation. The Greens also think that this is a good step in terms of financial reform. It does clarify the funding arrangements between the states and the Commonwealth, and that's a good thing, but we believe it doesn't go far enough, in that we would like to see a real health reform which would actually put emphasis on those health measures such as preventative care and primary health care, where there's a lot more gains to be made in the real health outcomes for Australians. So we'd like to see the government go further. Could
you move on to those things though without settling the financing of the public hospital system?
No, and that's exactly why I think that we do think it is a good first step. That has to be done. There's been a lot of discussion. There's obviously been give and take, and there's been this agreement reached. And it's interesting that both Western Australia and Victoria are acknowledging that it's a good reform. And I think that it now has to be that we focus on those things that we need to do away from the acute healthcare sector, which we require good healthcare, of course, for Australians, but there's a lot of evidence that if we were to put more funding and more effort into primary healthcare and preventative healthcare, we could actually keep people out of hospital and reduce some of those acute care costs.
Susan, do you think there's a cautionary tale in the history of this health deal, that it's better as a politician not to overpromise than underdeliver? It's better to keep the promises to what is achievable?
Absolutely, and it's best to bear in mind that you are the responsible manager of taxpayers' money. And if we consider the costs that have gone in to round 3, 18 months of negotiation, and a deal that really isn't anything like what was explained at the start, and when you think of the actual outcomes for patients, there was a promise that we would have a 4-hour time period before which you would be seen in emergency. In other words, you wouldn't wait in emergency for longer than 4 hours. Well, that's been watered down to only 90% of the cases, and that's only in 2015. Who knows
I
what
think
the
it's
landscape
actually
will
gone
look
up to
like then.
95% of the cases.
Well, the elective surgery targets have been watered down, the waiting periods have been watered down. It's been more a rewards payments to the states rather than a stick if they don't get it right. What we're seeing is a Gillard government desperate to sign up a deal to say that we have achieved something in the health area, and we really believe that the devil will be in the detail, and as it rolls out, I think we will see another series of disasters.
Penny, does the government have to be careful when it does things like setting efficient prices that it takes into account the regional differences there are in states?
I think that is really important, and that's why it's important that there's independence in terms of assessing what that efficient price should be. I'm also think it's good to have vision and to have ambition and to be aware of the things that are important to people, such as waiting lists, but it's also important not to have the tail wagging the dog, and what we wouldn't want to see is a situation where people are actually being forced to leave hospital early, or when it's contraindicated from their health needs because there's some artificially imposed time limit as well. So I think in all these things, it's important to be thoughtful and considerate and to try and get that balance right between the best system that we can have and working with the various components of that system.
If we could move on to another issue, the Immigration Department will put vision up on YouTube of the asylum seekers who've arrived when they are sent on to Malaysia to effectively send a message to those thinking of coming to Australia that they can't be guaranteed of staying here. Susan, is this the right way to use that sort of vision as a deterrent?
I don't think there's anything wrong with the Immigration Department putting its message out on social networking sites such as YouTube. The problem is the government that stands behind it. The problem is not the message, but the messenger in terms of the Gillard government. So people smugglers are simply getting a very strong message that it doesn't matter what you hear from this government, the reality on the ground will be different. 500 and something asylum seekers should already have gone to Malaysia by now, but they haven't. The latest arrivals were going to be turned around in 72 hours, but it doesn't look as though that's going to happen. The system is not ready. The system is straining. The options for the government, of course, in Nauru are there. They have waived East Timor, PNG, etc. From a people smuggling perspective, this is just one giant mess, and unfortunately they will continue to take advantage of it.
Penny, the department says that the privacy of the asylum seekers who may be shown on the YouTube vision will be protected, that their faces are pixelated. Does that ease any concerns you may have about the vision being used?
I find it really ironic, Lyndall, that we have the Immigration Department, which traditionally has been so careful about not allowing any access to these people by the media to have their photographs or, in a sense, their humanity recognised while they've been locked away in detention centres over many years, suddenly deciding for their own purposes to allow them to be put on YouTube as a salutary lesson for the rest of the world. No, it doesn't reassure me. I understand that the government is keen to publicise this current program, but what I think we have to remember is that this is a people trading deal. It's an inhumane deal, and what we're doing is we're exporting vulnerable people, including children, to a regime, to a country where their human rights will not be guaranteed. And if I can just say too that this idea that's now getting currency, that Nauru was some kind of nirvana for asylum seekers compared to what's being on offer now, is laughable. I, as a lawyer, am appalled at the way both old parties have bent over backwards to avoid the legal and moral responsibility that we have as a nation, having signed up to the Refugee Convention, to offer asylum to desperate, vulnerable people who come to this country seeking sanctuary with us. And so the idea that shipping people off anywhere, including to an isolated island like Nauru, is some kind of a humane or compassionate solution compared to what we have is laughable, and it's sad.
If I could move on to a final issue, Julia Gillard tonight will sit down with executives and editors from the News Limited stable. Susan, there's been lots of talk, particularly in the wake of the phone hacking scandal, about politicians, particularly leaders, sitting down with owners of major media organisations. Is it okay for Prime Ministers to sit down and have a chat with editors and executives from a major news organisation?
Well, of course it is. It's just a little bit odd. I mean, Julia Gillard has been slagging and bagging News Limited for the last couple of weeks as if it's some sort of evil empire and that no media consumer in Australia has any other choice. I mean, we've got the ABC, and even within the ABC we've got ABCNews24. We don't have to listen to any one of the diverse elements of the Murdoch press if we don't want to. But this is just a distraction, in the same way that Julia Gillard has realised that the public is not buying her message that you can control the world's climate from a room in Canberra. The public is certainly a wake-up that this is a distraction of high proportions in terms of the government trying to sideline what the real debate should be about today, and that is about what's happening in the carbon tax. But certainly, I mean, we have a diverse and strong media in Australia, and I think that the way Julia Gillard has tried to smear News Limited is appalling. She's consistently said they have a lot of tough questions to answer. Perhaps she'd like to release a list of what those questions are. Perhaps she'd like to, in this meeting, actually talk about those questions and allow the public to see for themselves what concerns she and her ministers apparently have.
Penny, do you think Julia Gillard should be asking the hard questions she said that she has for the News Limited executives, and should she also ask those hard questions in an inquiry that you've called for?
Well, that's a really good point, Linda. What I was going to say is, hard questions or not, and I don't know what the questions are that the Prime Minister will be asking, I think it's really healthy to ask questions about matters that are important to Australians. And we know that privacy and issues of media ethics and behaviour are particularly important at the moment for all sorts of reasons. We have the privacy aspects of the internet, of course, but of course also with what's occurred in Britain with the news of the world, people are becoming understandably and justifiably concerned about the length of time that appeared to have gone on. And what also we're realising is that it wasn't just a few rogue reporters, but in fact the chain of control in relation to that went to influential people, including, at least we know, Rebecca Brooks, who has been now, there's now criminal charges pending. So it's really important that I think we ask the really hard questions about a profession which I think is actually a really noble profession. It's a very honourable profession, but it's also one that carries a lot of responsibility in that it informs people about the very things on which they will cast their votes and will uphold democracy.
Susan, do you think there are questions of privacy that need to be asked in the Australian context, and that risks getting caught up in the to and fro of the political debate?
Well, I would just caution against playing the privacy card in a way that allows more control by government of the media, or which allows long-running inquiries with indeterminate ends and huge costs. I am quite proud of the media in this country. Now, the government and some of the ministers have done a dummy spit because they haven't read what they've liked written about them in some pages of the press. And let me tell you, as someone who's been in politics for 10 years, I've seen a lot of that on both sides. And why wouldn't the government be asking the tough questions? And why wouldn't the media be asking the tough questions of government members in this way?
And that's where we'll have to leave it. Susan Ley and Penny Wright, thank you very much for your time.